kyphoplasty. A kyphoplasty, so let's say we talked about compression fractures, right? Where the bone actually, you slip and fall, the bone fractures. Well, with a bone fracture, it's hard to see here, but let's say, you see this square here and that square there? Okay, this is good. There's almost nothing there, right? So what happens is the entire bone kind of crushes down. So, so one of the things that we do is we go in there with an x-ray and we inflate a balloon and create a cavity within the bone itself, right? Then we deflate that balloon, but there is a cavity there, so what we do is we inject, we call it synthetic cement, which is basically, not really cement, but we inject it there to do two things. One is it burns all the nerves within the bones itself, and number two, it stabilizes the vertebrae, right? So that it doesn't continue to compress. Of course, there's there's things we need to look at on a CT scan and MRI to make sure that you are a candidate for it, because sometimes the fracture is just so bad that really we can't fix it through this, and so we can get away with doing some facet injections or other things to deal with that particular pain. But this is actually a good thing, and you only have a short window. That's the problem. Once you fall and you hurt yourself and you're like, wow, I'm really hurting, you have about 6 weeks to get this thing fixed. Once it's fixed, once 6 weeks has passed, sometimes already your body is calcifying the space. You get calcification of the space, so it would be more dangerous for us to go in there and inject the cement along calcifications and things like that. So 2 ways of fixing fractures. Number one, kyphoplasty. If it's debilitating pain and you really can't do anything, you do it. Or just don't do anything at all. Brace yourself, and in 3 to 6 months, your own body will kind of heal itself. But this is a real good option if it's real severe.